Right, so when sugars like glucose enter the blood from food digestion, insulin is released from the pancreas to move this sugar into the cells where it's needed. So insulin is like the doorman. So it knocks on the door, it tells the cell that there's glucose here, and it ushers the glucose through into that cell. Now, in most cells, that glucose is used to produce energy inside the cell. However, in other cells, like the liver and the muscles, insulin instructs those cells to build those little glucose molecules back up into chains and store it away for later use. So it's stored away there for when we're sleeping, when we're in between meals, or when we're fasting, and we still need energy to keep our body running, all right? So this is how we manage to not have to eat every single second of every single day. So insulin effectively is our main storage hormone. So it tucks all that glucose up safely inside the cells. And this is a really important function because if insulin didn't do this, then blood sugar would get too high and would cause dangerous hyperglycemia, which is high blood sugar. Now, this situation is dangerous because when sugar is too high in the bloodstream, those sugar molecules can attach on to all sorts of other molecules or cells or tissues in a process called glycation. And this results in damaged molecules. Now, these damaged molecules are called advanced glycated end products, or AGEs for short. And essentially, these glycated molecules are implicated in cardiovascular disease, where this damage can cause hardening of the arteries and increase your blood pressure and your risk of stroke and heart attack. They're implicated in Alzheimer's disease, where it can cause problems with the blood vessels in the brain. It's been implicated in cancer and in neuropathies, which we often see in diabetics. You'll notice some diabetics will lose the feeling in the soles of their feet or in their hands and fingers, and they might get small cuts that they don't notice and they become infected. You can also get diabetics which have problems with the retina in their eyes. This is the same process that causes this glycation. And interestingly, this can also happen in the very cells in the pancreas that actually produce insulin in the first place. So we can damage our own ability to produce insulin by having a blood sugar that is too high too frequently. Now, the really important thing to note is that this glycation happens all the time, and it can be happening even if you don't have diabetes. Any amount of elevated blood sugar can start to cause these damaged molecules, and even if your body manages to produce enough insulin eventually and return the blood sugar to normal, often the damage is already done.